Welcome to this explainer, everyone. Today, we're taking a really deep dive into the technology, the architecture, and honestly, the incredibly intentional design behind a vital piece of medical equipment. We're talking about the Edan USA Elite V5 modular patient monitor. Let's just jump right in because when we talk about critical care divisions in hospitals, the tech sitting at the patient's bedside, well, it's not just about reading numbers on a screen. It's about providing a continuous, completely unbroken lifeline of data. We're going to unpack exactly how the Elite V5 pulls this off and why its very specific design choices matter so much for both the patients and the medical pros using it. Just to immediately establish the stakes here, take a look at this number, $4,624. That is the baseline price for this high-end critical care investment. Now, as you probably know, in the world of specialized medical devices, every single dollar of that cost has to be absolutely justified by tangible utility, rock-solid reliability, and real-world functionality. It's not just a fancy display, right? It's literally a central command station for a patient's vital signs. So what exactly does a hospital get for that kind of cash? How does this device fundamentally shift the workflow of a high-stakes medical ward? Well, here's our roadmap for today's explainer. We'll start with a quick overview of the Elite V5, then look at its role in seamless patient transport, dive into the mechanics of its plug-and-play modularity, check out its advanced diagnostic capabilities, and finally, wrap up with its smart connectivity and physical design. All right, Section 1, the Elite V5 overview, looking at how it functions as a truly comprehensive solution for critical care. So the foundational concept behind this machine is that it operates as a quote-unquote full modular monitor. But, what does that actually mean in practice? Well, it basically means this isn't some static one-size-fits-all box. It's a highly versatile, adaptable platform. By utilizing these plug-and-play modules, the monitor can literally physically change its capabilities based on the specific, constantly shifting monitoring needs of the moment. Medical staff can take the exact same machine from an intensive critical care setting all the way over to anesthesia monitoring. It's all about supreme flexibility in an environment where, let's face it, patient needs can change by the second. And that adaptability brings us right to Section 2, seamless patient transport, which is really where the patient's physical journey begins. So here's a absolutely crucial point to keep in mind. One of the most vulnerable times for a patient, and honestly for their medical data, is when they're on the move. Dropping data during transport from an ambulance to a hospital bed, that's a massive logistical hurdle. But the Elite V5 solves this by pairing up with a specific module called the IM20. Using the V5 together with that IM20 builds this completely seamless connection. Step 1 starts right in the back of the ambulance, capturing all those initial vital parameters. Then, Step 2, as the patient is physically moved inside the hospital walls, that data flow never drops. It translates directly into continuous monitoring right on the ward. There's no frantic plugging and unplugging of incompatible machines, just one smooth digital bridge. Moving right along to Section 3, plug-and-play modularity. Let's peek under the hood at the actual hardware architecture, essentially the brain of the monitor. The Elite V5 features this really extensive modular rack. Think of it as a central hub that accommodates multiple distinct data streams all at the exact same time. Because of this rack, the machine is able to monitor a wide range of parameters simultaneously. Instead of crowding the patient's bedside with, half a dozen different clunky machines for specialized readings, you just snap the right module directly into the rack. According to the specs, this includes some really advanced monitoring capabilities, things like ICG for impedance cardiography, RM for respiratory mechanics, and BIS for measuring the depth of anesthesia. Whatever the patient needs, the rack handles it all at once, keeping the bedside clear and all that vital data perfectly centralized. Next up is Section 4, advanced diagnostic capabilities. This is where we shift gears from the hardware over to the software that actively empowers medical decisions.
You see, the Elite V5 doesn't just sit there displaying raw numbers. It actually comes fully loaded with onboard functions explicitly designed to assist in medical treatments. We're talking a full 12-lead ECG diagnosis, built-in hemodynamic calculation, drug dose calculation, and IBP, or invasive blood pressure, overlapping. Now, why does this matter for you to take away? Well, doctors and nurses are out there making split-second, life-or-death decisions. They don't always have the luxury of time to step away to a separate workstation just to run complex drug math. These functions provide incredibly quick references right there at the bedside. They actively help the staff decide on immediate, on-the-fly adjustments to treatment plans. It's practically an active participant in the care process.
But, of course, all that brilliant diagnostic software is pretty much useless if it's a pain to navigate during an emergency, right? So the interface is this high-resolution 12-inch LCD touchscreen. But it goes way beyond just being a nice, clear piece of glass. It features a highly customizable shortcut menu design. This means medical staff get super easy one-touch access to those frequently used, complex functions we just talked about. They can literally tailor the screen to show exactly what they need, exactly when they need it, with absolutely zero friction. And finally, that brings us to Section 5, Smart Connectivity and Design, where we zoom out a bit to see how the Elite V5 actually fits into the broader hospital ecosystem. So we've established how it works at the bedside, but it begs the question, how does it connect to the greater hospital network? It definitely can't just be an isolated island of data. Well, the answer is that it comes packed with massive back-end communication capabilities. The Elite V5 connects completely seamlessly to hospital networks. It interacts directly with the broader hospital information system using HL7 output, which is the international standard for transferring clinical data, as well as internal Wi-Fi. But it doesn't stop there. It also connects to immediate ward-level infrastructure. It uses various connection options to talk to the hospital's central monitoring station, and it even directly interfaces with the nurse call system. So the data flows exactly where it needs to go, instantly alerting the right people at the right time. Let's pause for a second and contrast the typical physical environment of a hospital with the Elite V5's really thoughtful engineering. I mean, standard medical equipment is often incredibly noisy, right? You've got cooling fans whirring away, and those same fans are constantly pulling in and collecting dust. The Elite V5, on the other hand, utilizes a completely fanless design, and this achieves three absolutely vital things. First, it ensures low power consumption. Second, it maintains a remarkably low noise level, which is just huge for patient comfort and stress reduction in those intense critical departments. And third, without fans sucking in air all day, it helps keep dust well below the strict regulations of those highly sensitive medical divisions. It's such a small physical detail, but it has a massive impact on ward hygiene and overall patient well-being. When you take a step back and look at all of these elements together, the seamless transport, the plug-and-play rack, the onboard diagnostic software, the wireless connectivity, and that silent fanless design, it all perfectly aligns with this core promise from our source text. The Elite V5 is, quote, designed to provide a comprehensive healthcare solution. It really isn't just a monitor. It's a fully integrated ecosystem, purposefully designed to protect the patient and empower the medical professional at every single step of the critical care journey. As we wrap up this explainer, I want to leave you with a thought to chew on. We've seen how the Elite V5 uses its IM20 module and that modular rack to completely bridge the gap between the ambulance and the intensive care unit. So, as medical technology continues to advance, how will this core concept of plug-and-play modularity continue to reshape the very future of emergency response and patient transport? If a machine can adapt this much today, just imagine what the bedside command center of tomorrow is going to look like. Thank you so much for joining me for this deep dive into the Edan USA Elite V5, and keep questioning how the technology around us is evolving to save lives.